Good morning. Welcome to the Listen for Life Aphasia podcast. I have two wonderful guests with us today. You're going to meet Julie Latson of Care4, and she's going to tell us all about her company and how they can serve the aphasia community as well as the dementia community. I've invited back my friend Mary Osborne from Your Dementia Therapist to join the conversation so that we can put into practical terms how Care4 can support you and your person, whatever their diagnosis would be. So, without further ado, let's jump in.
Welcome to the Listen for Life podcast with Genevieve Richardson. Genevieve is a speech-language pathologist rehabilitating adults with communication challenges after a stroke or due to a neurological impairment. Get equipped with knowledge from experts in the field and professionals you need to know. We'll hear stories and experiences from others who are navigating life with aphasia. So, put your earphones in and take a walk outside. This isn't just a podcast. This is a community, a resource, and a support system. We're in this together. Do life.
Good morning, ladies. Thank you for joining me today.
Thank you for having us.
Yes, thank you.
So let's start with you, Julie. Tell us a little bit about yourself and how you have been in the care space. I know you started in senior living and you pursued more education, healthcare. Can you tell us a little bit about your background and how you came to be with Care4?
Sure. So I graduated in 2001 and kind of haphazardly fell into the healthcare space. So I started in senior living, did about 15 years in that environment. And while I was there, I did a lot of sales and marketing, but then I went back and got a master's in healthcare administration because I wanted to help operate the buildings. So I did that for a few years and then eventually transitioned into home health, hospice, and private in-home care. While I was working in senior living, I had worked with many care managers in the Austin area and came across Care4, which is really just an industry leader for Austin and surrounding areas. So when I was ready to make a change, I reached out to our current CEO, Catherine Vergara, and just said, what can I do to be a part of your team? And so here I am. I've been with Care4 for 2 years. What I thought they did and what they actually do is really so much more than what I even saw in senior living. And so it's really refreshing to see how helpful and beneficial we are to families, but also understanding that a lot of families don't know what we do. And so helping to educate people on what all we're able to provide and how it can make the caregiving journey just so much more, or I guess less stressful, and a lot more peace of mind in making decisions for loved ones.
I love your background. I love that you've seen every aspect. I mean, I can't think of anything you haven't done that has brought you to this point and working with Care4, being in the senior living space, home health, hospice. You've been on the ground seeing what families need, seeing what the person themselves with these diagnoses need. I just, when you and I were connected and we started talking, I'm like, we have to share the message about what Care4 does.
No, I very much appreciate that. I feel like I've seen families in all stages where they just have a new diagnosis and they're not really sure what it means, where families are not on the same page, not realizing where their loved one is in the disease process, total denial. So I've kind of experienced it all, and really Care4 helps put the pieces together for families.
I love that. So let's pivot real quick to Mary. Mary, we haven't seen you for a little while on the
No,
podcast.
been a
How
while.
are you? And
Good.
remind our listeners what you do.
Yes, thanks for having me, Genevieve. So, I own a company called Your Dementia Therapist, and my company provides digital education to help families as they're navigating a dementia diagnosis. My mission is to really just help families thrive despite the challenges that dementia brings along, and just to help improve quality of life for everyone involved in care, the caregiver, families, the person living with dementia. And so I have ebooks, courses, a monthly membership for family caregivers where I answer questions. I create weekly coaching videos. I have digital products each month that will help support family caregivers on their journey.
And I love what you do, Mary. The audience has met you a few times before, but I love what you do because you're all about empowering the caregiver, the care partner
Yeah.
with practical tools, action strategies, and there's just not a lot out there.
Yeah, I know.
And your social media, if you guys have not seen Mary's social media, you do need to check it out. She is very active in there with great, great videos, and your digital products are fantastic as well.
Right back at you, Genevieve. Your products are amazing too, and you do so
Well,
much in the aphasia space as well. So it's really
well,
great.
thank you so much. So we're just having a love fest today. All right, so let's jump in. I would love, Julie, can you outline for us before we dig into details, what are like the main areas that Care for can support families?
Sure. So, really, at the core of our business is something called care management, which a lot of people have not heard of. So, the way I like to describe care management, it's like when you have a project manager for a home and you've got one point of contact and they're coordinating all of the ancillary pieces to get that project completed. So, a care manager does that in the healthcare space. They come in, they'll assess the situation because everybody's got different things going on. And then they help people connect the dots through advocacy, connecting with referral sources like yourselves, just making sure they understand where that person is at and how to best connect with resources available to them in the area that they're living. So that's really the core of what we do. It's a lot of healthcare advocacy and navigation in the healthcare system. People don't realize how siloed healthcare can be. So when there's a need in the home and then it translates to the hospital, does their primary care provider know? Has their neurologist been, communicated with?
True.
Do people know what medications, others are prescribing? All of those little nuances our care managers can step in and help with. We are mostly comprised of registered nurses. We also have licensed medical social workers on our team. And so they're really looking at a clinical, through a clinical lens, but they're looking at the whole person because, again, no two people are the same. So they're really trying to advocate for that specific client. And then the beauty of care management is that you really can use us as little or as much as you need, because some families are highly coordinated and they're prepared to execute. They just really don't know what their next step would be. Some families either are working, they don't live local, they don't have the greatest relationship. So trying to tell mom and dad what to do can just be a pain point for them. And so in those cases, we're happy to take more of an extended role and hold people's hands and walk alongside them to get things executed on their behalf. So that's really,
Wow.
and
Yeah. I mean, my brain is going a million miles a minute here because, and we won't dig into it just a second, but that pain point of an adult children having to navigate with mom and dad and get them to do something, it might be really nice to have an impartial, objective, medically trained company and care team to
Mhm.
really help navigate that so that the adult children can stay adult children and not
Yeah.
become the coordinator.
It's Very interesting what a neutral third party can do in those situations that definitely have the clinical lens. It's kind of like when they go into the doctor's office and it's like the kids have been saying this for a long time and then the doctor says it and then everybody's like, yes. So it's a little bit of that where, we take the approach if we're advocating for our client, which would be the quote unquote patient, but they're our client because they're a person. And what are our wants and wishes? What do we want to accomplish? And then do we have the resources to match that, whether it be a provider through insurance like y'all are able to provide, or is there a private pay option? And so we just help to make sure that they understand and then help execute that plan if we need to get buy-in on the best next step of what to do.
Love that.
Yeah.
So that's a lot about the case or care management.
Mhm.
What are some of the other areas?
Between care management and case management, I hear those words kind of like,
Yeah, good point.
I was
Yeah.
just curious. And when you said that, I was like, I feel like a lot of people are like, wait, is it care management, case management is the same thing?
So this is what I think of. So case management to me is what happens in mostly like a hospital setting. So
Yeah.
you've got like a nurse case manager. They're there to help with discharge. They typically have a ton of people that they're trying to help with. And so it's similar.
Mhm.
Care management is truly managing care.
Okay.
So like case is the specific case in a specific setting doing a specific thing.
Mhm.
Care is looking at the totality of the picture and making sure we're not just addressing that little piece, we're addressing the whole picture of what that person may need. So it's a little bit more nuanced. And again, I think that's why a lot of people haven't really heard of what we do and how it can really facilitate the necessary pieces to give families just like true peace of mind
Yeah.
for what would be best for a loved one.
Awesome.
That's great. Thank you for bringing that up, Mary, because I think that's part of the complication of when you have a diagnosis. We
Yes.
don't know what these words.
Yeah. And I've gotten that question before from folks. So I'm like, okay, we need to clear that up probably on the phone call just to.
Yeah, no, that was great explanation. So what else besides care management does Care for do?
Sure. So we actually do a couple of services under care management. So for folks who don't have anyone as a primary or secondary medical power of attorney, we can serve in that capacity. So a married couple, no children, or a solo ager that doesn't have anyone, never had kids, estranged from kids, whatever the case may be. We also have a full guardianship program. So people who really the provider has deemed them to lack capacity, court systems are involved. We can serve as guardian of the person, guardian of the estate. But separate from the care management components, we also do private caregiving services. And so what we have found is it works beautifully when you have care management and private caregiving, even just in the same house, if that makes sense. So not everybody has to use private caregiving along with care management. Some people don't necessarily need that. They just need the private caregiving. But the benefit to having it in the same organization is that our caregivers are very familiar with working with our care managers. So there is a degree of support and truly oversight that you just don't find in a freestanding private caregiving organization. When caregivers have questions about changes in disease process, they're doing this now, they were not doing this before, they actually have a clinical person they can reach out to ask questions to. And it makes a huge difference for the longevity of our caregivers. They feel more supported. And then just the quality of providers that we are able to bring on. We want to professionalize caregiving. And so in order to do that, you really need to have the supports for the caregivers built out in your organization, and Care4 does an amazing job with that. So we can do medical, non-medical, meaning we can drive people around, we can help bathe people, but with the nurse delegation, we can also fill pill boxes, we can administer medications with our caregivers, things like that, which really takes it through a whole different really through what a person's journey may actually look like. So you don't have to start with one agency and then maybe switch to another. We're full service on the caregiving side. And then the other cool thing that we do that I had no idea we did when I started is we actually can do something called direct to consumer. So if people have private caregivers in their home, they've not gone through an agency, they've found a family friend, a church member, someone online that are bringing into their home, we can do payroll processing for those folks. So making sure they're paying into Social Security, getting taxes accounted for. But the other really beautiful thing about that is there's just some degree of oversight. So it keeps that relationship, in my opinion, a little more professional, where all caregivers can get close to the people that they're caring for. But when you're submitting time to a third party like ourselves, there's some accountability there. And so we do payroll processing for a fee. So the client set the rate with the caregiver, and then we add a percentage on top of that for payroll processing services. So I think
love
great.
that.
Isn't that great? I know.
Really cool.
Yeah.
And the important part is that third party accountability.
Mhm.
So I can think of one of my clients. She's long gone. We'll call her Phyllis, and she had a neighbor coming in to help her, and it went along great for a few weeks. And then there was something, I don't exactly know what happened, but there was something that happened, and there was a conflict with hours, and then the daughter got involved, and it just blew up into this thing. And then there were a lot of hurt feelings. So I think if there was that third party accountability where we know how many hours are supposed to be worked, we submit those hours get paid out, payroll. I think it just, like you said, it adds that professional
Mhm.
component to it, and it can help take some of the pressure off the relationship.
Mhm.
Yeah.
And
It-
that's what we want, right? We're trying to
Yes.
decrease stress and overwhelm.
And the thing is, it's not like they can't even bonus the caregiver. I mean, there's a lot of things that happen that they want to do for people, and that's totally fine. It's that added layer of support and protection for families and the care receiver to make sure just what is being submitted is what
Yes,
is being
Mhm.
requested and
absolutely.
approved. Yeah.
Yeah, I think that there's definitely a place for it, and that puts you guys at the forefront of doing this. Yeah, I can see, even if that were just one thing a family could come to you guys for, and then when they understand your other services, that can really take off a lot
Yeah.
of
I
pressure.
actually have a past client who reached out to you guys, and they have their own caregivers, but they just kind of wanted someone in there like you guys to help coordinate care and just a care manager to kind of oversee everything. So
Mhm. Yeah. Thank you.
yeah.
Yeah, I wonderful
Mary's been
service.
great to work with. Yeah. We always
Yeah.
So awesome. I just want to tell everyone about you guys because I think it's so important to have this in place. And I especially think it's important in the beginning of a diagnosis, right? I think it's so important to have a service like this to where you can go in there and really kind of like meet everyone where they're at and see what their needs are and go from there and kind of help them coordinate everything and get everything together for what they might be seeing or, what they might need.
Well, and I also think too that people expect that type of service to happen from their doctor. And
Yeah.
so when they get that new diagnosis or when something's gone on,
Mhm.
I really truly believe that people are looking to their providers to be like, well, now what, now
Yeah.
what do we do?
They don't have that.
And
Yeah.
some are certainly better than others, but you're really left to your own to sort through
Mhm.
what your resources could possibly be. And there's just so many things that people don't know about. They don't
Mhm.
understand what's covered by insurance.
Yep.
They don't understand what could be covered by long-term care insurance. Do they even have it? So there's a lot of nuances where even if someone just does that initial meeting and assessment to just get the lay of the land, I I wish it was offered through like Medicare and,
Yeah.
Humana and all of the things, and it's just not. I think it would save a lot of people certainly stress and time, but quite frankly, it saves people money because
Mhm.
you're not wasting money on resources
Yeah,
that may not be sustainable
for
or
sure.
the best fit for what that particular need is at that time. And so just really having a clear understanding makes all the difference in the world.
Is the home setting typically where y'all, like, do the initial kind of evaluation, or would it be in the hospital, or it just kind of just depends case to
Yeah,
case?
it can be anywhere. So we're meeting them where they're at. We do planning services, meaning people can come to us before they actually have any needs, just
Mhm.
to document wants, wishes, kind of get a plan in place for what they need.
Oh, I
Um,
love
but I wish everybody did that. I'm
it. Yeah.
honestly including myself. Like I'm not the best planner.
Yeah.
And so usually we're getting people when there's already been some sort of health event. There's already the diagnosis or a hospitalization. And so it's either we're meeting them at home, we meet people in the hospital, we are in senior living communities, just wherever they're at, we'll meet and figure things out. Yeah.
Awesome.
Mhm.
I love that. So maybe as people do like their estate planning or they do the updating of
Mhm.
the wills, their trusts, their medical power of attorney, they can have a pre-planning. How did you put it? Before a health event, you're doing a
Yes.
pre-planning
It's
kind of
almost
setup.
like I use the phrase sometimes contingency care.
Mhm.
So
Ooh.
you don't really need anything, but you want to you do certain documentation through your legal documents, but
Mhm.
what most people don't understand is that is truly like when you're in a hospital setting. So
Mhm.
you don't spend your life in a hospital, right? So you need to get other things documented for planning purposes. So
Mhm.
if you ever did go to the hospital, like you would know what your best next steps would be and what you want. And it's really interesting because oftentimes, I mean, even meeting with couples, they've actually never had that conversation before. You'll
Mhm.
have one who is like, "Oh, I'll go to senior living," and the other one's like, "I'm staying home at all costs." It's like they've
Yeah.
never actually even talked about it. So we can help people get their wishes documented, help understand what the cost of care is, and then
Mhm.
that way they can truly make a plan, and things change. And so that's why you need to update it every so often. But like even a medication list, do
Mhm.
you have your most current medication list, your most current list of doctors, a copy of your insurance cards? Is that somewhere in your home and easy to find?
Yeah.
And most people would say no.
Yeah.
Like maybe one of those or maybe two, but certainly not all
Yeah.
of the things that they need if there was an emergency. And not only do you have those in your home, does anybody know where to find them?
Yeah.
And so we just work alongside people to help do those things.
I'm so glad you're putting this on everyone's radar, the pre-planning before anything even happens, right? I think that's so important because that wasn't even something I was thinking about that y'all could offer. So I'm
Mhm.
glad to know that as well.
Yeah.
Yeah.
So our founder, Debbie Pearson, she started the company back in 2000. She's amazing. Um,
Incredible.
she's so great. But that is her big thing is
Yeah.
planning. She's written a book and then a workbook that works together because planning is such a huge it's just such a big deal. And that way, when we're stepping into the crisis, you're just not
Mhm.
guess because you have a plan. You know what
Exactly.
you want to do.
That's awesome.
Yeah.
Mhm.
So, Mary, let's put you on the spot. Can you propose a client example, somebody that you've worked with recently,
Yeah.
and then let's put Julie on the spot, and let's just all talk through
Yeah, for sure.
what something like this might look like in practical terms.
Yeah, let's start with maybe someone who is in the early stages of dementia. Maybe they're aware of their diagnosis at this point. The caregiver is aware. Everyone just needs more support. So what does this look like with hiring your company? Can you kind of walk us through what this might look like?
Sure. So, what we would want to do is we would want to get that family connected with a care manager. And depending upon the situation scenario, we try to pair our care managers in terms of their skill set, with the client that we're meeting with. But we would start with an initial meeting, which would also include an assessment. And so that would be face to face. We'd want to review medical records just to kind of get that clinical picture because it's interesting. Sometimes people will not provide the full picture because they've just forgotten that,
Mhm.
oh, I also have high blood pressure or whatever. And then really based on that conversation, we're coming up with a plan, which today for that scenario may be more just about education. So
Mhm.
let's provide some education about what to look, what we need to be looking forward to and what things we can put in place now to make us more successful for what may lie ahead. And then really beyond that, it would be just the conversation with the family. They may not need any private caregiving support. It may be a good opportunity to introduce something like a 1 day a week just to get used to having someone in the
Mhm.
home and
Mhm.
give the care partner some respite. And so it's really just that conversation that care manager can stay involved or not and set a follow-up time like let's check back in 6 months, let's check back in a year and see where we're at and just reevaluate. The really cool thing is once people get established with us, if anything changes, they have access to our team. We have a care manager on call 24/7.
Mhm.
So if there's an urgent situation and the care partner doesn't know what to do, they would have access to our team member, and we store all of our information in an electronic health record. So we can access that and say, okay, this is what we saw was going on. Let's step in and help triage that situation. Or it may just be like, we check back in a year.
I love that. It's a very personalized approach based on what everyone needs at that moment. Like you said, things could change. So then you could always come back later and kind of be like, okay, this is where you're at here. Like, let's look into this.
Hmm.
Awesome.
Yep.
I also think it's great having another set of eyes in a house on the family because
Mhm.
you might be seeing things like people aren't coming around as much anymore. They're not getting out of the house as much anymore. Their mobility has changed.
Yeah.
Just like these subtle kind of declines in socializing,
Hmm.
physicality, however we want to put that. Just having somebody else that is professional in the care space, knowledgeable and experienced can
Mhm.
really help stave off a lot of bad things that can happen. I don't have a better
Mhm.
word than bad.
Yeah.
Negative things that can happen over time when you have a diagnosis. And it could be a cancer diagnosis. It doesn't have to be aphasia or dementia. It
Yeah.
doesn't matter what the diagnosis is. The support is still there and valuable.
I know, I love that, and I love that you're looking at, like, all areas too. You're like, okay, respite for the caregiver, so you're planning ahead on that front, right? By getting that person in maybe 1 day a week, just depending on the situation. So it's kinda like you are filling in those missing pieces of the puzzle, and that's
Hmm.
great.
Well, and then some people will have a new diagnosis, but it doesn't mean that they have not had the disease for a while.
Yeah,
Mhm.
When
for sure.
someone says, I just got diagnosed, I mean, that could
In the
be
middle
anything.
stages of
Yeah.
yeah.
That's right. That's
Mhm.
right. I had another thought, but let's keep going. So I have an idea. What about someone that's maybe 6 months after a stroke? They have aphasia, they have a communication impairment, and they are just not doing as much as they used to do. Like now it's a frequent example I give. It's when the dust settles, rehab is over. Maybe the spouse has gone back to work full time, part time, and the person is sitting at home. What could Care for possibly provide in a situation like this?
Mhm. So, I mean, in that situation, I always think every family could benefit from initial assessment.
Mhm.
It just gives everybody the clarity of like, this is what we're seeing in this moment based on our interactions, your environment, and medical records.
Mhm.
But in a situation like that, I think it also that assessment would help us tailor a care plan for providers to come into the home. So private caregiving would probably be a really nice option to do a couple of things. One, I mean, companionship, there's all kinds of studies out there about socialization for adults and what that connection with other people means for quality and longevity of life. So, introduction of private caregiving, but not just, hey, let's toss it to the window and see what sticks. Let's actually look at what the partner's work schedule is. What are things that you're interested in doing? What can we continue to provide from the therapy perspective? Maybe exercises that were left behind that the caregiver could work with the client on. And so we're just truly building out that personalized service plan for that person based on what they need, what they can afford, or if they can't afford private in-home care, is there a respite day program that's appropriate for them to attend? How do we get there? Setting up just those pieces to make sure that that person is not just at home by themselves, not able to, have the best quality life possible. Because really the nice thing, and there may be people from certainly outside the scope of Austin, but at least for Austin and surrounding areas, we are so lucky to have so many amazing resources available. It's just you have to know about them. And so that's really where the care managers, because they're coming from years of working in our healthcare space and connecting people with those resources, they know what they are. And so just having that, understanding that there's a church that provides a respite on Tuesdays once a week that this person could possibly attend can make just such a difference in a person's week. So it's figuring out where they're at and getting the
Yes.
support places.
Love that. Now, Care for, are you guys only in Austin, or do you serve outside of the Austin area or in other states?
So our particular agency, we serve from north of Georgetown to south of San Antonio. Kind of, I've heard our CEO call it a fat Sharpie up and down that 35 corridor. So Bastrop, Lago, Lakeway kind of area. We are a part of a larger national organization. It's called Aging Life Care Association. So if there are needs for providers in other parts of Texas or certainly in other states, they are welcome to reach out to us and we can get them connected with someone who does a similar service in another area. Or you can go onto their website and it says find an expert. And so you can put in your zip code and you can locate someone in your area to do that. What I would say is having a local resource versus like a national provider, it makes such a difference. Even the market from Austin to San Antonio looks so very different. So you really need to have someone who has boots on the ground, who knows that space and can help.
Yeah. And because this is a national audience, we might even be outside of the US, but I want people to understand, and that's why I bring local companies like Care4 on, because people need to know what is a possibility. And I appreciate that you gave us a link to the bigger association that can help people where they live find services like you guys provide here in Austin.
Absolutely. Yeah.
Austin, San Antonio area.
Yes, for sure.
Terrific. Well, Julie and Mary, I appreciate both of you very much coming on, talking about this. I would like to wrap up with an action item. I'm putting you on the spot, Julie. So could you think of an action item, some kind of a challenge to families based on our conversation today, something that they could put into place, implement, phone call they can make? What do you think?
I mean, other than calling us, we're
Right, of course.
I mean, honestly, I think if they have not yet, coordinating a family meeting sooner rather than later to get everybody on as much of the same page as they can is always a really good start for a lot of reasons. It helps the care partner understand where other family members may be coming from, their connection to what the disease process may be. Are care partners in denial? Where are we at as a family? And then depending upon how that family conversation goes, I mean, certainly reaching out to a care management company to help get that like neutral third party eye, it would serve so many people for not a lot of cost just to get the information and the peace of mind that they need for what may lie ahead, I would 100% say would be a good action item to
I think
consider.
it's excellent.
Yeah.
And I want to touch on the finance part of this because I think we tiptoe around paying for things. We think everything should be covered.
Mhm.
And we know in reality, working in the healthcare space, it's not.
Mhm.
So you can't expect the doctor to provide this for you. You can't expect Medicare or your Medicare Advantage or your insurance company to pay for these things or even be thinking about these things for you. So we do have to have the hard conversation that this is an investment. And what does this investment give you? Peace of mind, planning, hopefully decrease on stress and overwhelm, where you, despite a diagnosis or a new health condition, maybe you can navigate this easily
Yeah.
instead of hard.
Yes, you're absolutely right. I mean, wherever anyone is located, I think having that initial meeting, pretty much all care management services are fee for service.
Mhm.
But if you can budget for that initial meeting assessment and plan, it 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 will be so eye-opening for what are costs? Like what is the cost of private in-home care? What
Mhm.
does it look like for a private provider versus an agency? What are your local resources for communities in the area? Do you have respite programs, day programs that could help fill gaps? I mean, just understanding what is available and out there and what would be a threshold to start accessing those services, I think would be invaluable to people. And again, do we wish that this was covered by Medicare? Absolutely. I will say, even with long-term care insurance, there's just a handful of policies that will cover, an initial care management assessment. Very few do,
Mhm.
but it's so worth just the knowledge so you're not guessing. So I mean, I'm a
Right.
huge proponent.
Yeah.
Yeah, the investment, just like we might invest in healthcare, not healthcare, like the gym or taking some kind of an exercise class
Mhm.
or getting our coffee in the
Yeah.
morning, right? I think this is where in healthcare we have to have the conversation about investing
Yes. I
because
totally agree
it's
with that.
instead of being reactive, let's be proactive.
Yeah.
And I love your action strategy. Let's get a care planning session done
Yes.
with a company like Care4 so that we know what we're doing. I mean, mom and dad, we're having this talk,
Mhm. Yeah.
because it's time.
Yeah.
Well, and just generationally, things can look so different.
Great
Between
point.
what mom and dad are willing to talk about, finances and those types of things, and what the children need to know. And so again, having that neutral third party facilitate those things, it just makes it easier.
Yeah.
And similar to how you need legal documents, which you pay for,
Mhm.
you need planning documents, which you pay for. But once you have them, you have them, right? So then you've got a roadmap for what may be ahead, and you'll be prepared to make those decisions. And if something changes because life is not, you know, we don't know what's going to happen, and something, then you've got someone who at least knows who you are and
Yeah.
knows generally, some information about you who could help you pivot.
Yeah.
Because there's a lot of pivots in life.
Yes, for
Yeah.
sure. And at least you've done that planning up front where you're like, you meet with you and then you kind of go through everything and help with that. So that's great. Love that.
Well, Julie,
Yes.
thank you, thank you, thank you. I will pop up here. I have
Oh, thank
care4.com
you.
and I should also put up Your Dementia Therapist. Hey, I did that pretty good.
Can you put up yours too? Because I'm going to share this with
Oh,
my email
sure.
subscribers as
Mine's
well.
longer. Hold on one second. I got to type. Talk, Mary, while I type.
No, this was so great. This was so great. I'm so glad to just meet with you guys and talk about what you do. Wait, Genevieve, well, I guess you're already typing, but Can you just kind of give like just a little overview of what you do? So when I send this to everyone on my list, they'll know exactly like
Oh,
what kind of
sure.
services you offer.
So speech pathology, private practice here in Austin, but nationwide. I'm currently in 11 states, and where there's a need, we go. Our specialty is really chronic aphasia because it's after that dust settles. It's after that rehab is done when the family goes, holy cow, what do we do now? We still have a communication impairment. We
Mhm.
still, I'm a caregiver. I'm not a spouse anymore. How do we get back to that communication and connection? So everything we do is about whole person, whole family. It's
Yeah.
built into how we do treatment. When we bring somebody on, we bring their spouse on too,
Mhm.
because if the spouse doesn't have the resources and support, how are they going to help their person with aphasia improve, right? Because if they're burning themselves out and they don't know how to, again, because there's piecemeal here, there's piecemeal there.
And I think you're
And
hitting on something really important that all of us, what we all do is we really are very holistic in our approach. We look at everyone involved and
right,
fill in those missing pieces. And I think that that is just a very important piece of the puzzle that, what we were talking about, when you go to your typical healthcare provider, they just don't have the time to touch on every single piece. So
you can't.
yeah,
Because there's so
there's so
much. And
many things.
that's
Yeah.
right. And that's part of why I started this podcast, because we're not just talking about aphasia. We try and tie everything back to aphasia in some way, but
Mhm.
it's about resources because
Yeah,
care partners don't know what they don't know.
exactly.
And depending on where they are in their journey, what they will process. They might have been told it, but they don't remember. If they're anything like me, if I go to the doctor and he tells me 5 things,
Yeah. It's like,
because he's talking a million
oh,
miles a
yeah.
minute, I'm going to remember 2 to 3 of those
Yeah.
things.
Yeah.
And imagine it was somebody even more overwhelmed.
Yeah.
Like so tough. So everything we do is telepractice, direct treatment for folks with aphasia anywhere. Once they're out of the hospital, we can treat them, but even down the road, even years later, because neuroplasticity is real. We can
Mhm.
tap into it. There is a way to keep improving communication and connection and doing the things you love.
I love that.
You don't have to settle.
Yeah.
You don't have to settle.
Yep.
So thank you for that, Mary. So, okay, one more time on all the websites, care4.com, yourdementiatherapist.com, and do life speechpathology.com. And I put do in there because sometimes people think the company is do life. It's technically life speech pathology because that's what we're trying to do is live life, but it's also about doing life. So it's that empowerment action kind of step.
Love it.
All right, ladies, thank you
Thank
so much for being
you
here.
for
This
being
was
here.
a great conversation. Let's have some more. And I wish you all a wonderful rest of your day and stay tuned for the outro.
Thanks for tuning in to the Listen for Life podcast. We hope you feel empowered and supported. Head over to listenforlifepodcast.com to see the show notes with links and information from today's episode. Do you have a topic, a resource to share, or a guest recommendation? Inquiring minds want to know. Let us know in the comments section. Wishing you a fabulous week.